Recorlev, levoketoconazole, is a prescription medicine used to treat high cortisol levels in adult patients with Cushing syndrome who cannot have surgery or who have had surgery that did not cure their Cushing syndrome. Recorlev is not to be used for treatment of fungal infections. Please see important safety information, including boxed warning for liver damage and heart rhythm problems, at the end of this video, and medication guide and full prescribing information for Recorlev at www.recorlev.com.
Being active is a really important part of my life. I grew up in Miami, Florida. Lots of love for my big Cuban family. I really enjoy salsa dancing as a result of that. It just runs in my blood. I started riding bikes in Florida. I moved out here to Los Angeles, learned how to ride on hills and mountains, which was a whole different experience. Awesome. I was having a lot of panic attacks, and that was just kind of written off as, well, anxiety. My blood pressure was kind of out of whack. They put me on an antidepressant, and I just followed the guidance of doctors, and none of that really helped. So looking back at things like that, it's very obvious now what that was. I got kidney stones, went to the ER, got all the scans done, and in those scans it showed that I had some lumps on my adrenals. It turns out that they were benign tumors. And at the time I was told, don't worry about them, we'll just monitor them for size and growth and see what happens over time. Fast forward to a year and a half later, and before even doing new scans, they kind of looked at my old lab work and noticed that my ACTH levels were really low. And I so perfectly remember the endocrine surgeon saying to me, you don't look like it, and I really doubt this is the case, but I want to test you for Cushing syndrome. We did all the lab work, and then I remember sitting at work, and I got a call from the nurse, not even the doctor, and she's just like, we're diagnosing you with Cushing syndrome. I was connected to my current physician, who is a specialist in Cushing's. He told me about a clinical trial that was going on. The study I participated in was for levoketoconazole. At the end of the study, when I got off the medication, I remember feeling pretty scared because I wasn't sure what was going to happen. Was I going to get this medication again? I started really not feeling well in mid to late 2022, and I decided to go check in with my doctor to see what we can do. And that's when he told me that the FDA had approved Recorlev, and it was now available to me if I wanted to start taking that. My doctor made it very clear that the goal of this medication was to normalize cortisol levels. Yeah, I remember feeling hopeful, like just a weight off my shoulders. I started at a lower dose and then worked my way up to see what was the right dosage for me. I started to feel really tired. Things just weren't right. I had really bad brain fog, and it turned out that my cortisol had dropped a little bit too low. After we found the right dose, my cortisol levels normalized, and I was starting to feel better. As with anything, there's side effects that I had to get through, and at first it was tough. It was an adjustment period. It made my skin kind of dry. My lips, for example, are hypersensitive now. The worst was the GI issues. It was like sometimes nausea and discomfort and bloating every time I ate something, but that went away after a while. But those are, if not gone, they're manageable, and my day-to-day is a lot better. I've been on Recorlev now for a little bit over a year. I'm always a fan of treating the root cause rather than putting Band-Aids on things, because that just creates more problems. So I'm really glad that I'm taking medication that's aligned with my values. I feel a shift in my energy. Having less fatigue just gives me more confidence to make plans with friends. Now I feel like I can go and participate, and I can make plans ahead of time and not be afraid that I may not be able to make it because I'm tired or don't have energy. I am much more excited about the future and just really looking forward to the things that I wasn't sure in the past if I was going to be able to do. Having the energy to do that is a great feeling.
Indication: Recorlev, levoketoconazole, is a prescription medicine used to treat high cortisol levels in adult patients with Cushing syndrome who could not have surgery or who have had surgery that did not cure their Cushing syndrome. Recorlev is not to be used for treatment of fungal infections. Important safety information: Recorlev can cause serious side effects, including liver damage, hepatotoxicity. Some people who were treated with ketoconazole, a medicine like the active ingredient in Recorlev, had serious liver problems that required a liver transplant or led to death. Call your doctor right away if you have pain on the upper right side of your stomach area associated with nausea, unusual fatigue, yellowing of your skin or the whites of your eyes, or unusual bruising or bleeding. Heart rhythm problems, QT prolongation. QT prolongation can cause irregular heartbeats that can be life-threatening. Call your doctor right away if you feel severe lightheadedness or if you faint. Low cortisol levels, adrenal insufficiency. Recorlev may cause adrenal insufficiency by excessively lowering production of cortisol. Call your doctor right away if you have nausea, vomiting, dizziness, unusual fatigue, low blood pressure, unexplained stomach pain, abnormal electrolyte levels, loss of appetite, low blood sugar, or body aches. Do not take Recorlev if you have cirrhosis, active or poorly controlled liver disease, frequent stones in gallbladder, or history of liver problems due to use of a drug. Take certain medicines that cause QT prolongation or may affect how your liver works, such as CYP3A4 inhibitors. Have a history of certain heart problems, which may include one of the following conditions: torsade de pointe, ventricular tachycardia, ventricular fibrillation, or long QT syndrome. Are allergic to levoketoconazole, ketoconazole, or any of the ingredients in Recorlev. Serious allergic reactions can happen in people who take Recorlev, including rash, itching, hives, fever, swelling of the lips or tongue, chest pain, or trouble breathing. Recorlev may lower testosterone levels. For males, symptoms include breast enlargement and erectile dysfunction. For females, symptoms include low desire for sex and mood changes. The most common side effects of Recorlev include nausea, vomiting, low potassium, easy bleeding or bruising, high blood pressure, headache, liver injury, abnormal uterine bleeding, redness of the skin, fatigue, abdominal pain or upset stomach, arthritis, upper respiratory infection, muscle pain, abnormal heart rhythm, back pain, sleep disturbances, and fluid retention. Before taking Recorlev, tell your doctor about your medical conditions, medicines you take, and if you are breastfeeding or plan to. Recorlev may cause fertility problems in females and males, which may affect ability to have children. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, see medication guide and full prescribing information for Recorlev at www.recorlev.com.